afternoon, everyone. It's April 16th and the Board of Health is meeting. We're going to go into executive session before our monthly Board of Health meeting. So, Lindsay, can you do a roll call for us?
Sure. Harriet Hall.
Here.
Jerry John.
Here.
Lane Drager.
Present.
And for the record, Sarah Lampy and Rochelle Woods are absent and a quorum has been established.
All right. Let's see. Carrie, you're going to share the statutory
Yes.
notes for our executive session.
Yes. Lane, may I please have a motion to go into executive session pursuant to 24-6-402-4B CRS for the purposes of receiving legal advice regarding Board of Health malfunction enforcement and new enforcement updates.
So moved. Second.
All right. Motion and second. All in favor, say aye.
Aye.
Aye. All right. We'll now move into executive session. Those that are here for the board meeting, stay with us. We'll be starting that at 4 o'clock.
All right. Has the recording stopped?
Hold on one second. I was just double checking my list here.
It's
Okay.
still
Mr. President, Sarah Lampy just did join. I just saw her.
Great. You should have everybody in, including Audra, from Mitch's team. So we should be good. You can go ahead and start and I'll pause the recording.
All right. And I meant to ask this of you, Lindsay. Do we have language justice folks today?
Yes, we do. I am not sure who's joining us from CLC.
I see Gisela.
You do see Gisela? Okay, I will.
Well,
Just give me one sec.
call our 4 o'clock, 4:01 now, our April 16th Jefferson County Board of Health meeting to order. And yeah, if we have our language justice folks to support us, that'd be great.
Okay, Gisela, you
Awesome.
should be ready. Yep.
Yes,
thanks.
thank you. Hello, everyone. My name is Gisela Escobedo, and I'm here with Vidia Sosa, and we are with the Community Language Co-op. And I just want to say thank you to the organizers of this event for your commitment to language justice. Thank you for giving an opportunity where people can participate and engage in the language of their heart, the language that they feel more comfortable in, that is the language that we practice at home. So to create this space, we're going to be using simultaneous interpretation. When I finish saying this in Spanish, we're going to turn on interpretation, and you're going to see a globe icon on the bottom of your bar that says interpretation. If you're not fully bilingual, I ask that you select your preferred language, if it's English or Spanish. If you're bilingual, you don't have to use our services. Now I'm going to say this in Spanish. Hola, buenas tardes a todas las personas. Mi nombre es Gisela Escobedo y estoy aquí con Vidia Sosa y estamos aquí con la Community Language Co-op y quiero darle las gracias a los organizadores de este evento por su compromiso a la justicia del lenguaje. Gracias por crear una oportunidad donde las personas pueden participar e involucrarse en el idioma de su corazón, en el idioma que se sienten más cómodos, que es el idioma que practicamos en casa. Así que para crear este espacio vamos a estar usando la interpretación simultánea. Cuando termine de decir esto, vamos a aprender interpretación y usted va a ver un icono de un globo en la barra debajo de su pantalla que dice interpretación. Si no es completamente bilingüe, le pido que seleccione su idioma preferido. Cualquier pregunta nos la hace saber. Muchas gracias. Thank you very much. You can go ahead and turn on interpretation.
Thank you, Gisela. Appreciate you. All right. So we have called our meeting to order and we have a full board. So Rochelle and Sarah joined right as we were going into executive session. So we have all 5 board members. Hello, everyone. And we're going to start with our consent agenda. So if I can get a motion from anyone on the board to approve our consent agenda.
I would so move.
Have a motion? We have a second.
I'll second.
All right. Motion second. Any discussion? related to that prior to vote? All right, all those in favor of approving the consent agenda, please say aye.
Aye.
Aye. Any opposed? Any abstaining? All right. And just for notes, I was not at the last one, so I did look at the meeting minutes, but I know I was not part of that meeting. And I appreciate Sherry for running that. Thank you so much. Lindsay, do we have anyone signed up for public comment today?
We do not have anyone signed up.
All right. Just as a reminder for folks attending our meetings, we're happy to have you here and joining us. And if you have a desire to share comments with the board, please use the online sign-up function. Thank you so much. All right. Salma, we are ready for a financial report if you're available.
Hi, can you hear me? Sorry, I
Yes.
was unable to mute. Right. Hello, everyone. I will share my screen here in a second. Sorry, a lot of windows to minimize. Hello, everybody. Today, I will be presenting the March 2024 GCPH financial summary. And as of this reporting period, with 25% of the year complete, our total revenues are being reported at 30% of the annual budget. I'm excited to continue to announce that our grant revenues are remaining on track with budget at 25%. A lot of credit goes to our financial analyst, Suzanne Atwood, who has been working closely with program supervisors and providing monthly projections to help them obtain the necessary tools to run their programs and their resources timely. When it comes to charges for services, our mortuary revenues are reported on target with the projected budget. Client fees are slightly ahead of the budget by 2%. However, I'm also excited to announce that we do have the mobile van that should be expected to be placed in service within the next few months here, and we should be able to close the gap or pick up on this particular revenue source. When it comes to our overall revenues and when excluding restaurant licensing fees that are collected in advance, it appears that we are also on target at 25% with our total revenues. Moving to expenditures, salaries and benefits, although they are currently reported at 23% of the budget, please note that payroll is only reported through March 23rd, and when factoring the remaining 8 days, we are also on target with the budget. Other charges for services are currently being reported at 32%, which is typical at this time of the year, as we are closing and wrapping up our contractual or consultant agreements, especially for those awards that are ending June 30th and July 31st. Again, this is also typical to see this trend at this time of the year, and we should see it balance as we move to the third quarter and the fourth quarter of this fiscal year. Direct assistance line item, please note that this is a very small line item. The annual budget for it is $7,600, and this line is specific to incentives and payments to students, which we have issued at the beginning of this year. We are still in the process of identifying capital projects and equipment, basically infrastructures or computers that need replacements before or by the end of this fiscal year. Intergovernmental currently being reported slightly ahead of the budget, and this is also typical to see at this time of the year, especially since we are remitting payments to state for restaurant licensing fees that were collected in advance. Please note that also cost allocation charges are not reflected on the financial statements, and we should see those being reflected within the next few months. Although it appears that we are at 10% of our county transfer, I want to highlight that when factoring cost allocation charges of $682,000 And when prorating March payroll and prorating EHS revenues, it appears that the department would have utilized 26% or 2.4 million of the county transfer allocated to the department. So I'm really excited to announce that we are on track. It's really great to see us on track with spending down our county transfer as early as the first quarter of this year. That's all I have, unless if you have any questions.
Thank you, Salma. Board, any questions for Salma? I would entertain a motion to approve the financial report.
I would make a motion to approve the financial report.
Thanks, Sherry.
I will second.
Motion and second. Any additional discussion? All those in favor, say aye.
Aye.
Aye. Any opposed? Any abstaining? All right. Financial report approved. Thank you so much, Salma.
Thank you.
All right. Now we're going to be moving into new business and our on-site wastewater treatment system enforcement. Mitch, I think you are leading our discussion.
Sorry, actually, I'm going to pass that off to Amber.
Yes. So, board, today we are presenting to you a vote on two separate cases. The first is 2835 Southeast Grapevine Street, in which a deadline to file a motion for default judgment has been set by the court of April 18th. And we are asking this board to vote on whether to approve the filing of the motion for default judgment against Lee Meyer, and to vote on the amount or provide guidance around the amount of the daily penalty to seek if a motion for default judgment is filed. And again, the board shall consider the seriousness of the danger to the health of the public caused by the violation, the duration of the violation, and whether the person has previously been determined to have committed a similar violation. The board has the discretion to request a penalty up to $50 a day. The second item for the board's vote is 625 Loveland Street, and we are asking the board to vote on whether to institute a separate nuisance action in addition to the agency actions that have been taken, which again will result in a hearing being held on April 24th to determine whether or not to issue a cease and desist order on the property.
And if I may, Mr. Chair, before the board entertains a vote on either of these matters, if there are questions, please issue them to staff and to Amber so that a robust discussion can take place on the record in the public setting, public record.
I do have a couple of questions. Amber, if you could just walk through and just hit the high points. I know that we've heard this issue before, but
Yes.
you're going to have to refresh our minds. So the high points, if you will, and the steps that you've taken.
So let's talk about 2835 Southeast Grapevine Street. We received a complaint. The agency received a complaint on June 2nd of 2022, stating that the on-site wastewater treatment system at the property was surfacing on the ground of the property. The inspectors confirmed that that was indeed happening. On April 26th, 2023, so about a year later, and after many efforts to work with the owners, Jefferson County Public Health issued a cease and desist order requiring the owner to bring the on-site wastewater treatment system into compliance or thereafter cease from occupying the dwelling. There was no change. On August 16 of 2023, this board issued resolution number 2023-1815, finding that the property owners had violated Colorado's On-Site Wastewater Treatment System Act at 25-10-101 by failing to abide by the terms of the cease and desist order. It at that time assessed a penalty in the collective amount of $2,050, which comprised a $50 a day penalty between the issuance of the cease and desist order and the date of that resolution, which again was I guess it was August 16th of 2023. The agency subsequently filed a complaint with Jefferson County District Court to enforce the terms of the cease and desist order and bring claims under the state nuisance statutes. And the court is now requiring that we file a motion for default judgment no later than April 18th.
Which is in 2
Because,
days.
which is in 2 days, and the defendant, Mr. Meyer, has not appeared and has not answered. So any motion, so we're looking to you for a vote on whether to proceed on that motion for default judgment.
And if my memory serves me correctly too, it was a lot of complaints from neighbors that sewage was running all over the property. There was mass
Yes.
leakages or whatever you want to call them.
Yes, and I don't have, we did present pictures back in August of 2023,
Right,
which
okay.
actually showed the level of the surfacing onto the ground, and it was pretty significant.
Okay, and they have not complied with anything.
They have not.
Okay. Thank you, Mr. President, for allowing my questions.
Any other questions for Amber or staff? Amber and staff, whoever is best suited. So we've already issued a penalty that they have not paid for violating the cease and desist. And then now we're potentially able to add to that penalty. And my question is, what is our financial sort of need for the funding to help support the program efforts to this date? Because I don't expect that they have any financial ability to pay even more. So just wanting to understand what a rough idea of our costs so that we know what these kind of enforcement cases cost. So
I do not have the costs in front of me. Mitch, I don't know if you do.
I don't think we have an exact number. It's going to depend on a couple different things, mostly the type of work type and amount of work that will need to be done. Usually when it comes to repairing a septic system, if it's just a tank, for example, that might be a couple $1,000s, but if it's a full system, it can get pretty pricey. It used to be about 20 to 30,000. I hear that they start going north of that if they've got really difficult sites that need a lot of extra treatment, which this area is kind of known for.
So that's kind of what the price tag for them to fix it is. And then we are looking to potentially add additional penalties on top of that, which again, I'm assuming is going to be even more of a challenge for them to pay that on top of all of the costs to repair it. I'm just wanting to get an idea of how many hours we spent, so we have a ballpark of what our costs have been, which would make sense that that's what we're seeking in penalties.
What I would note, Lane, is that the regulation provisions, the considerations that the board is required to take into account at this point, frankly, don't include the board's costs. And I apologize, I did not I anticipate that much of the board's costs is the litigation costs incurred in enforcing this to date. I can perhaps pull some of that information up, but I am not sure if that's something that we should be part of the public meeting. What I can say is that the considerations would be the seriousness of the danger to the health of the public, the duration of the violation, and whether there was a similar violation in the past. Here we have a long duration of violation. We have not come to this point with this individual in the past. And the seriousness of the danger to the public is reflected in some of the images that were shown in the August 2023 meeting and in the executive session, just reflecting the kind of depth of the flow.
Agree with that, Amber. I think that really the cost that needs to be considered is to the health of people in the area around where the sewage is leaking. I think it's really within everyone's best interest that we get that situation resolved and taken care of. And I know that this has been going on for a while. An ongoing issue is something that we should take and do want to take into concern, of course, as the board, but more importantly, the danger to the health of the public. I don't get the impression that this is going to be resolved without the county coming in, having the public health interest at heart, despite the unfortunate situation that the individual themselves might be facing. Because the truth of the matter is the cost could be astronomical to somebody who gets an illness from sewage that's leaking. And that for that person could potentially be something lifelong. So we would really, really want to think about that.
Harriet, go ahead.
Yeah, so just to clarify, the result, so first of all, just to clarify, the individual that owns this property does not live there, but his grandson does. And the result of the default judgment would not just be the financial penalties, but also that no one could live in the house. Is that correct?
That is correct. It
Okay.
would be a court judgment enforcing the terms of the agency's cease and desist order. And that order precluded anyone from doing business or residing on the property until the sewer system's fixed.
Okay, so currently they are in violation of that order, both because they haven't vacated the property, they haven't fixed it, and they haven't paid any of their fines.
Correct.
Thanks.
So the board could file a motion, a default motion. What would that look like? Would you, Amber, help me with my words as the attorney?
Our Colorado rules provide for a entry of default if an individual does not appear in a case. That happened here, and the court made an entry of default in its file. At the same time, then the court looks to the party to file a motion explaining exactly what it is they're wanting the court to enter as a judgment. And that would be the motion that we present. Frankly, it's going to be based largely on our complaint, and the motion is asking for what we've discussed: enforcement of the cease and desist order and application of additional penalties, enforcement of the existing penalties that the board issued in August of 23 in the amount of $2,040. And in this particular case, the court entered an order that requires we file the motion by the 18th.
Any additional questions for staff? Have we heard anything back from the property owners at this point?
We have heard from Lee Meyer, who is the property owner, and he has indicated that he doesn't expect to appear in the case. He doesn't expect to litigate or defend the case.
And then no plans for remediation of the property at this point?
No plans for remediation.
Okay.
He believes if he is able to move, which he anticipates doing, understanding that the owner is currently at a nursing home. If he moves from that nursing home, he anticipates some additional funding. And he did represent that he would utilize some of that to try to fix the malfunction. Right now, he does not know exactly what the malfunction is, and neither do we.
And those are all possibly.
Correct. Those, I would say those are only very possible, and
Yeah.
at least
So he does not know for sure that he will be moving out of the nursing home. And if he does not know when that would be.
yep, you've encapsulated it.
Well, I believe that the board can make a motion to file for a default. Is that
Default
the proper
judgment.
motion? I mean, you
Yes,
want me
a
to put it in
motion
other
for
words, Mr. President? You're pretty good at those words. But nothing is going to happen. This has been going on for how long? We've heard this many months back, and it's gone all the way through the process and nothing has been done.
So Sherry, can you share, you're making a motion for us to move forward with a default judgment?
Yes.
Okay. And then is there any
I'll-
specific, hang on, before we finalize the motion, the other question in that is there an additional penalty assessment that the board wishes to add on top of that?
It's not going to get paid. I mean,
So does the current penalty assessment continue to accumulate?
No, that's the additional penalty. Frankly, had you assessed penalties today instead of in August 2023, the penalties would have accrued till today. Right now, it's going to be enforcing the 2040, and for consideration today, whether we request additional penalties beyond the August 2023. We could also defer to the court's judgment.
I think I would be in favor of deferring to the court's judgment.
So is that your motion then?
Yes.
Okay, so we have a motion.
I will second that motion.
All right, just to make sure I have it clear for all of the board members, we are asking our staff to move forward with a default judgment and defer to any additional penalties based on court's decision. All right.
That is my motion.
We have a motion and a second. Any additional discussion from the board members? I definitely support the idea of the court deciding if they really feel additional penalties are needed at this point. I would like them to be able to have the money available to try to fix this system. I guess the other components are as these motions are made, staff referrals to support the disabled grandson who's living in the home, getting resources. I'm not excited about the opportunity of having that person become unhoused as a result of this. So not necessarily making their health situation any better, potentially making it a lot worse. So that is still something I do care about in the health of our community. And that would hopefully be something that we can try to find as many resources as we can to support that.
Understood. And we are absolutely doing so.
No, I know you are, and it's a very difficult situation. All right, so we have our motion. Last call for discussion. All right, all those in favor, please say aye.
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 Any opposed? Any abstaining? All right, motion passes. Now we have our second property, 625 Loveland Street. And Amber, again,
Yes.
if you can just do a very quick highlight of the timeline of incidents there and kind of the overview of what's going on in this property.
Yes,
For the
we have
record.
this is 625 Loveland Street, where we have a history of complaints dating back to 2014, 2015. The operative complaint here was dated October 8th of 2023. Once our investigators secured access to the property, which happened in January, they were able to confirm that there is a malfunctioning on-site wastewater treatment system. The owners have actually removed the pipe from the system such that any sewage will flow directly into the backyard. This is a home that has not been well taken care of. There are household items in the backyard. There are weeds, human level, in the backyard, and there's also household items in the front yard. And two individuals who state that they are residing in an older van that is parked on that front yard. We have currently a notice of violation that went out in February. We have a hearing before a public health officer set for April 24th. That is the agency action being taken on this property. The agency is presenting to this board the question of whether the board would vote to institute a nuisance action on this property right now, in addition to the agency actions that have been taken.
Thank you, Amber. Any questions for staff on this case?
I think, I just want to clarify that you said, in my mind, you said that the two individuals were living in the van, but do we know that for sure? I mean, are they not going into the house really? Has anybody proven that?
Good questions. Verifying the statements of the owner who says she lives in the house behind the one street back from this house, or her guests who state that they are there to assist the owner with the items in her house and don't use the house. It's very difficult to verify. We only have their statements to us. We have, the investigators have seen at least one individual inside the house who answered the knock on the door. Not the owner.
Any additional board questions for staff?
I wonder if staff could summarize for us what they see as the public health risks of this situation.
Hi, everybody. This is Mitch. I'm the Water Quality Program Supervisor for Jefferson County and overseeing my staff that are helping with this case or leading this case. To answer your question, Harriet, the public health risk to this is we do, in fact, have sewage and feces and pathogen-containing material going onto the ground, going onto the surface in the yard. We do have some issues with some harborage for rodents and other pests and stuff like that. So our goal here is to basically make this, if the person were to choose to live there, whoever is living there on site, a viable, healthy living situation for these people.
And Mitch, just to add, Harriet, just to add to that, we did test E. coli in the residue, I believe, but the public health risks of a malfunction ultimately include waterborne diseases, including the groundwater, which here we have a sewer system going directly onto the backyard.
And Amber, can you share any response from the property owner on any efforts that they're making or desire to remedy the situation?
What I will, yes. Thanks, Lane. What I will share is that the property owner does not seem to understand or appreciate the level of public risk, is not in agreement that there is a malfunction, and indeed had tried for months before we gained access to the property to convince the investigators that there was not a malfunction. It took the investigators securing a warrant and personally inspecting the property to find that the outlet pipe was cut off from the system and just flows into the backyard. So to date, we seem to have a property owner who does not wish to comply and frankly just does not understand the seriousness of the violation.
Thank you.
I think that this situation poses multiple public health issues. Not only the fecal matter urine in the yard or whatever, but as Mitch had stated, there's issues where there's like rodents coming into the area, which also bring disease. In looking at some of the photos, I'm of the impression that there's probably multiple people who come in and out of this particular address, whether they're living within the house or not. And just that sort of an atmosphere, in my mind, raises concerns about other communicable things that could be potentially being passed within, this residence. I completely appreciate that there's multiple things going on here that are a threat to public health. However, the resident making that decision to cut that sewer line and to just drain septic contents into the front yard, that's obviously not okay. That is, of course, very high risk for public health. And not only that, it's a direct nuisance to the neighbors and a disregard for the community. Certainly it doesn't smell pleasant. And so that's, another thing to be taking into consideration as well. Strong odors can cause some folks to get sick and they trigger migraines, things like that. There's just multiple angles to this. And I feel that we really need to have the public health's best interest at heart and see if we can't get this taken care of sooner rather than later.
Would anyone like to make a motion on this case?
Amber, what are the two different ways that what do you suggest the options of the board might be?
Yes. So one option would be to vote to institute a board nuisance action now. The second would be to see what happens on April 24th. We have a hearing scheduled. Depending on what happens, so if a cease and desist order is issued at that time, the board could at or very shortly thereafter institute the nuisance action, which would ultimately be combined with the agency action in court if it becomes necessary. But it allows the opportunity for this issue to get in front of the judge more quickly. And then the third option would be for the board to vote to allow the agency action to proceed to conclusion, that would be a cease and desist order, and then the agency taking on the district court action if necessary.
I think having the expertise of the department to be able to do what they need to do, option 3, door number 3, because I think that we should give you the opportunity, or the agency the opportunity to take it all the way through the process.
All right.
I mean, that's just my thought. I would certainly refer to my colleagues or defer to my colleagues.
Sarah, go ahead.
Yeah, I have a slightly parliamentarian type question. So if we're not taking the action of the nuisance today and either deferring it to after the hearing or not waiting until the agency action is done, do we actually need to take board action today? I don't know who's going to answer that question.
Yeah.
I don't know.
I'm
either.
curious. I don't know the answer.
I think my understanding would be, yeah, if we don't have to take an action, that is one of the choices, is we can let the division's enforcement action play out, and then we could still come back and do this nuisance action after that if it doesn't resolve the issue to their satisfaction. So that is one of our options. Or I think the other thing that Amber is sharing is we can escalate this right now, even before they've had their hearing, which I'm not sure which is more helpful to the staff. Maybe that's Sarah's question can be posed back.
Right.
Jim and your team, what's the most support for your team?
I don't know that there's a best answer, Lane. I think, my best answer would be that it's apparent after so many months that there's no intent of fixing the problem. And this home, whether it's occupied or not, does not have a functioning on-site wastewater system. And because it's in the sewer district, if I'm understanding that correctly, we would not issue a permit for an on-site wastewater system repair because it would need to be connected to the sanitary sewer system. So but we've all heard too that there's question as to whether the house is even occupied. So I think, it might be worthwhile to go ahead with the administrative hearing. And then if a cease and desist order is approved or issued at that time, to take that, we typically give a 30-day period for compliance. At the end of 30 days, we go to court, right? Amber, I'm looking at you. So, I think if it takes another 30 to 45 days on a situation where, and maybe do a little bit of follow-up work to investigate whether anyone's actually living in the property or not. And if somebody is, and there's evidence of sewage on the surface of the ground, that perhaps we would need to come back to the board quickly for an escalation.
Thanks, Jim.
I think that makes sense, with an understanding that we as the board want the staff to bring it back to us as soon as you need us to, and as soon as it seems like that is the most prudent course in terms of public health, which could be as soon as next month, if that's your choice. I mean, if that's your judgment.
Yeah, I think your hearing is a week and a half away. So Sarah, go ahead.
Yeah, that was my Lane, you kind of just took the words right out of my mouth, but the hearing is a week and a half away. I think we'd like to have maybe an update after that hearing to know and understand what has happened in that situation before. And my preference would be before we take action is to know and understand what the agency action result is. in that situation and then make a determination of, is it, because my understanding is part of the reason why this is coming to us now is to expedite some of the long drawn out aspects of this process. So to know and understand if it is a good idea for us to file the nuisance sooner to expedite any follow-up action that might need to happen. But I think the hearing to me feels like an important first step before we do any expedition beyond. I don't even think expedition is the right word, but expediting anything beyond this point.
Yeah, and I think Amber, you also mentioned that if we wait and file this, we would be able to add additional components from the hearing to our filing. So that seems to also make sense and probably would be looked favorably in the courts too, that we are following all the administrative processes and exhausting every possible means that we have before forcing the court to take action. And that being said, I think staff have spent already an inordinate amount of time on this property, and when you look at all the history of complaints, so that is a challenge. Okay. So with that, board, what's the thoughts of the board? Wait for the hearing? Is there a consensus around that?
That would be my preference, to let it play out, let the agency do what it needs to do. And report back to us.
Rochelle, how are you feeling on that?
I think that Amber is going to come back next month and we're going to add a nuisance complaint, but it's good. Let's go with what everyone is saying. I just, again, have my eye on that public health prize. And I don't think they're going to be compliant. I think this has been going on. However, I'm not in disagreement with what my board member peers are saying. I just think that I'm going to see Amber again soon. So
Yeah,
I'm good.
I agree with you. My preference would be to not have conjecture to go to court with, that we think there's people living in a van that are using the house when the homeowner has said that they've moved out. So having stronger evidence in addition to this hearing seems like it's going to make our case more of a slam dunk. Then we find out nobody is really living there. It is vacant already. And so the cease and desist has already been in effect even before the hearing is. So just getting all those pieces, that's I guess why I also prefer for having the hearing to happen.
Yep.
All right. I appreciate the guidance of the board. Thank you.
Thank you. And thank you for all the work on this. All right. Mitch and Amber, is that the end of our enforcement new business? Okay.
It is. Thank you.
Thank you. I think we're ready for updates. Dr. Story, are you leading that off?
Yes. Hi. I almost said good morning. Good morning. Let me put my desk up a little bit. Good afternoon. Good evening almost. Very excited to get away from sewage for a second and get us into something different, but not any less serious than that. I will share my screen real quick, and there we go. Okay. Great. So I'm going to, do you see my screen?
Yes.
Okay. I'm going to actually dig in a little bit on one issue that's really top of mind for us right now, and then give you opportunity to ask questions about that and anything else. And I'm also going to talk about our honorable mention this month for Employee of the Month. And then I'll let some others pop in with some other updates. But I want to talk to you this month about Sexual Health Awareness Month, which is an opportunity for us to kind of draw some attention to the broader issues of sexual and reproductive health. But I specifically today, because it is very timely, I want to speak on syphilis and show you some data. Thank you to Cody, who you got to hear from. I believe it was last month or the month before. I mean, everything kind of melds together a little bit, but he brought data on communicable diseases largely. And now we're going to focus solely on syphilis for a second because it is so shocking, the numbers here and nationally. But thanks to Cody, we were able to get our case data from the state from 2013-14 to 2023, which is a little more recent than some of the data that we've looked at recently. So I kind of put this screenshot on the side there with this article on NPR from January showing this is a national problem. As I said, we are seeing the highest levels since the 50s. And there's a lot of evidence to say that actually syphilis mortality rates are increasing for the first time in recent history. So even while cases since 2000 to 2014 have increased, mortality in that same time period went down. So we were catching them earlier, which, right, is an indication that we were seeing increased screenings and we were catching syphilis earlier and therefore able to treat before it went on to a later stage where mortality is more likely, death is more likely. And what we're seeing now between 2015 and now is that every year the mortality rate is getting higher. And that is especially driven by congenital syphilis, which is syphilis in fetuses. And so that is something we'll talk about in a second as well. And Kelly Curl, our policy advisor, will give an update after me, and this will be included in that as well. So it's all kind of coming together. The chart on the left is diagnosis of syphilis over the last 10-ish years by sex at birth, male or female, and then the total. So you see this huge spike. Now, this is number of cases with sexually transmitted infections. We don't usually make them a rate like per 100,000 because we don't have a good denominator. We don't know out of how many people who are sexually active. That's not something the census asks. So we really just look at case rates. You can, though, imagine that, you know, this is almost a 3.5x, 4x increase in number of cases, which strains the system, obviously, since 2019. That's very recent. You can imagine our population did not grow at that same rate. Otherwise, we would have a very crowded county if our population tripled or almost quadrupled in that same time period. So there is some mental gymnastics we need to use as we're trying to uncover what's behind this. There is no one answer. That is also the case for our diagnosis by race and ethnicity. So in 2014, 58% of those new diagnoses of syphilis were in non-Hispanic white residents of Jefferson County. This is all county data. And 20% were self-identified Hispanic of any race. You'll see if you fast forward from 2014 to 2023, we're now seeing 39% of those new diagnoses are our Hispanic neighbors. And we have that kind of shift from the non-Hispanic white population to the Hispanic population. However, since your first instinct would be, is this proportionate to the percentage of people who identify as Hispanic in the census or the American Community Survey? The answer is no, that this is disproportionately burdening, meaning it's burdening Hispanic folks more than they make up the proportion of the population. So they are overrepresented in new diagnoses of syphilis. Anecdotally, we're seeing that white and Hispanic men are more likely to get diagnoses later stage syphilis, which is a lot harder to treat and could end up leading even decades down the road to death or permanent, some permanent disfigurement, paralysis. There's a whole bunch of things associated with syphilis. The Hispanic population in the same time span went from about 14-ish% to most recent projected for 2023, 16.6%. So that 39% is quite powerful number. The diagnosis stage, this is to me the most troubling. Now, there have been changes in the way that we test and in the way that we kind of categorize syphilis, but not enough to make this difference go away. So in 2014, 37% of the cases we were catching were catching them in the first or second stages, which treating syphilis is a lot easier. And there are going to be subject matter experts in syphilis and sexual health on this call. So afterwards, if you want to ask some more specific questions, you're welcome to. I'll answer what I can. But now we're seeing we're seeing the undiagnosed cases of the past now presenting as latent, which is not even third stage. Like this is beyond. And we are seeing an increase, though it is still rare, thank goodness, but a very big increase in congenital syphilis in the Denver metro area. Again, it is rare still, but pregnant women who are not screened for syphilis, who pass syphilis to their unborn child, that unborn child has a 31% chance of dying. 90% of those happen in the womb, so that they are still births. And most of them happen in the third trimester. So that's a very painful experience that is completely preventable and avoidable by early testing and treatment. So what are we going to do about this? Well, you'll hear from Kelly later about the policy landscape, but we're approaching kind of, this is an emergency situation. Like this is a real big wicked problem for public health. A lot of it is tied to public health funding for screening and prevention. But that aside, what we are doing is first, I'll go from the bottom up. We are going to stand up kind of a task force, right? An internal task force where we've got people from all different divisions thinking through what's our multi-pronged strategy for this. We're going to dig in more on the data, more on the national research, trying to find peer counties that we can collaborate with in order to understand if people have done their own primary research, really what accounts for this steep increase. And in Jefferson County, what can we do to understand more about these new diagnoses? Because we are diagnosing ourselves. Like, we are a clinic that does testing and treatment. And so we need to understand more about the personal histories and the stories so that we can actually design effective interventions. But it's really hard with the data you get off the shelf. We are going to be, for this and many other reasons, we are going to be creating with an existing FTE, so this isn't a new opportunity, someone whose full-time job is really to own Hispanic health equity strategy and to ensure that we're applying equity principles and that we're in the right places for the right reasons. And so we're still working on finalizing that role and identifying who would be best to step up into that role. But I plan to have more news on that at the next meeting, your next meeting. Max is also on the call. He'll be talking later, but we are scrapping and we are finding and we are going under every rock and every couch cushion to find resources to expand our jail program. In the women's jail we are right now, eventually expanding to the male facility. We're going to need people, we need supplies, we need things. We have a great relationship with the sheriff's office. And so I think the sky's the limit with what we can do. And I know that the team just this morning messaged me about getting funds to do some contraception work in the women's jail as well. And so really, like, it's not just about syphilis, but it's really about expanding that program. If we don't, who will? And then launching tomorrow, you will see on our social media. So please amplify and share and repost and all of those things, especially on LinkedIn. The team shared this morning that our engagement, I think our clicks on LinkedIn were up 900% last month. And so I'm very proud of them. And our Instagram engagement, which is the hardest to see movement on because public health isn't usually Instagrammable, 75% increase in engagement. And so that's very exciting. And I'm really proud of that team for trying new things. One of those new things they'll be trying is some very bold work, which comes out tomorrow, focused on youth. And so this will include not only just social media images, but print posters, and most importantly, digital toolkits for school health professionals. And so this is really was the brainchild of our creative team. And this, Noella says social media is out now, so you can find it up there. I'll show you images in a second, but we've been bringing together the subject matter experts we have in-house and letting them just talk about their work. And when they talk, magic happens, and they'll say something that will be the impetus for the entire creative campaign. And then our creative team will take it and run with it. And it's been a really great cycle of new ways of doing this work. And so sexual health was our time to be a little more direct. So Hisaya, who you've met before, who's our sexual health nurse practitioner, she's amazing. And she started off the conversation by saying, you know, these kids come to us and they just don't know basic facts. And she's like, and I feel like just telling them, yes, you can get an STI that way. And that clicked for us. And we thought, okay, let's just be very straightforward with youth. And so right now you can go find it. And if you want some posters, let us know. But we're just being very, very straightforward with youth. And we're saying, yes, you can get an STI from anal sex. There are kids coming into the clinic, young people, young adults who did not know that was true. They did not know that they can talk to a provider without a parent. They didn't know, and this is something, I mean, my own kids, we all message tested on our own teenagers, and of course they were embarrassed. But then my daughter said, well, I'm never going to forget that. And I was like, great, that's exactly what we were going for. You can have an STI and not have any symptoms. Like, and my teenagers, you know, public health mom were like, really? Like, and so this is the kind of work that we think it's very targeted to a very distinct audience, but we hope it'll get in the hands of caregivers and professionals so that they can start these conversations as well. So just a little bit of an attention getting, you know, beautiful campaign, and congratulations to the comms team, because they're really making some really powerful content. A few other things, and then I'll stop for questions before I go to the Employee of the Month stuff. Honorable mention. I wanted to give some updates from last month. We did kick off our RIHEL training on emotional intelligence for people managers, and we focused first on our nervous system and regulating that in the workplace. And I meant it when I said we were starting at foundations, and we're starting with our bodies and our minds, and we're building from there. So I'm very optimistic about it. The feedback was very good. And the way that our fight or flight kicks in the workplace is worth spending some time on, especially just coming out of, for this staff, a lot of transition time. And so very grateful to the people managers training group, Donna Viverette, Karen Wiggins, Jessa Woodward, Alex Hopkins, for doing a lot of that planning. We are going to have a summer internship extravaganza. And so at some point this summer, our students will be presenting to you, the board, and getting experience with that. But this can be bigger than anything we've ever done. It's in partnership with the county. So it's actually a county funded initiative. And we put forward multiple pathways. And from what I can tell, feedback from the interviews is that we were the most popular place to try to get an internship. So that's very exciting. We're capitalizing on the fact that all these kids want to go to med school, so it's the closest they can get. So we are going to have about 9 to 12 high school students here this summer doing meaningful work. And these are some of the smartest, funniest kids in Jefferson County. So I'm excited. So we're going to have them making advertising campaigns. We're going to have them doing emergency preparedness kits and tobacco outreach. And so they're going to be all over the place. And so you will get to meet them during the summer experience. And if you're interested in coming here to meet them and telling them your story and about your career. We're really trying to match every student with a mentor that could help them think through their future. So if that is something you're interested in, email me or Lindsay, and we'll get you connected with the coordinators of that. As a follow-up to the WIC funding, which we've talked about before, you may have seen that the state released the new WIC funding formulas to teams across the state. Alex is out of the office. She's at a tennis camp, which is so amazing. But I'm going to ask her to speak on that more in May at our meeting, because it is actually quite a significant reduction for Jefferson County based on our reduced caseload. And so we'll talk through a little more, maybe in a study session. If it's not taken, it might be taken by air quality next month, but at least in new business to give you an update on that. All I can tell you now is that we'll have to do more with less. And we're thinking through ways we partner with other counties surrounding us to absorb some of, potentially absorb our clients, some FTEs. So there could be some good partnerships there with others who actually have seen increased caseloads over the last couple of years. Two more small things. Our new quality improvement process kicked off about a month ago, and we just got the first report for two of the, sorry, I got a pop up at the same time and it completely distracted me. Our Q1, QI findings, we focused on accounts payable, which is invoices and payments, and then contracts. And so one of the things that came out of that, besides a very small tweak in accounts payable, it's going to save us hours of time. So thank you, Faro, who's on Myra's team on health planning, who's the captain of QI for our department. Contracts is going to require some efficiencies that have to be approved by the board. Regarding county attorney's office review, currently the board has said that all contracts need to be reviewed by the county attorney's office, which probably made sense in a certain context, but we think, and I've talked to Carrie about this, we'll be putting together just some ideas about ways that we could streamline review, but they will require board approval. So look for that next month, if not the month after that. Lastly, thank you to those of you who could be at Public Health Champions. I thought it was a beautiful day. I'm so sorry you couldn't all make it. I'm happy to recreate it for you. But the team that planned it went different this year with a little stand and mingle and walk and talk. And it was very classy and casual. And I was really happy to see our elected officials stayed through the whole program, which is really a testament to how engaging it was and how awesome the champions are. So thank you for being there. Thank you, Lane, for taking on so much of the MC duties and for all the pictures we had to take. We do appreciate you. So before I move on to the honorable mention, I will stop there and take any questions about those updates or syphilis related things.
Questions for Dr. Story?
Dr. Story, I just wanted to tell you thank you for the very timely and important syphilis update that you provided. I did also want to mention that on April 1st, CDPHE did issue a health alert network broadcast for new screening recommendations for syphilis and congenital syphilis due to this increase that we're seeing in Colorado. And of note, the new recommendations do include screening during pregnancy 3 times, and that would be at the first prenatal visit, early in the third trimester, and at time of delivery. So yeah, big strides to try to help those smallest Colorado citizens. So really important for that screening and testing. So yeah, thanks for sharing that. And those new guidelines can be found at the CDPHE syphilis provider webpage in case anybody wants to read further.
Thanks, Rochelle. And Kelly will be talking a little bit about the accompanying bill that uses those same guidelines. And the sad part is those have been recommended guidelines in like OBGYN for a very long time, but the proportion of patients and providers like compliant, the proportion of providers compliant with those guidelines is very low. And so we have to figure out some mechanisms by which to support compliance of those guidelines. So thank you, Rochelle. Sarah, oh, sorry, I didn't know if I was supposed to call on you, but I guess I have the control right now. So Ms. Lampy.
Thank you. I have a couple of questions. So, in the syphilis presentation, afterwards with the actions that you're taking, there's some really specific focus on youth in jail. And I didn't see a whole lot of data that was supporting and understanding as to why those two populations were the focus. Could you provide just, and I am guessing, I have a lot of assumptions that are really positive and good reasons, but I'd love to hear a little bit more why those two populations are a focus in preventing syphilis as well as other sexually transmitted infections.
Yeah, great question. So I didn't use it because I was running out of space. I thought it was going to be data heavy. The youth diagnosis is almost steeper than this in a shorter amount of time. And so when I think about, from a public health perspective, where am I getting the greatest return on investment with a focus there? It's going to be in the kids who maybe haven't even become sexually active yet, right? So I'm trying to stop it before it starts. Also, based on our just kind of small sample evidence, we're thinking about where can we expand our market for clinical services, because we have a very ambitious goal, of a 50% increase in patient touch points over the next 18 months. We're trying to catch up a little bit with Denver Health, with all of our surrounds. So that's also part of it, to think through who are groups, whether it's youth or people in the carceral system, that are kind of untapped, unhelped, unsupported, right, by the normal systems, right, the traditional systems of healthcare. We see a lot of kids who are just scared to go anywhere else. We see a lot of, young people. I call them kids just because I have teenagers. I don't mean that pejoratively, but we see a lot of young people who come here as almost like a secret last resort, right? They don't want to go to their pediatrician, they don't want to go anywhere else. And they're not potentially ideal Planned Parenthood patients, right? Maybe they're queer youth and they're not really thinking about pregnancy, and that's how they're associated planned pregnancy, so Planned Parenthood. And so it's really interesting. We're not an FQHC, which has different requirements for identification and paperwork and things like that. So we're a little bit of a different provider, and yet I feel that we are underutilized. Also, our relationships with school health is pretty strong. And so we see that as a really viable source of partnership for us. We could have done this same campaign, but with, people who inject drugs, right, who are a major risk. But we do a lot of work in that space, and we are testing for syphilis out there, and we are doing all those things. But when we think about creative content and social media campaigns, we're also thinking about who are we looking to engage in those spaces. For jail, I want to say specifically, one of the things that shocked me the most when the champions of that program came to me to tell me about it, it's been in the works for a while. The syphilis rate, you have a denominator in a jail. The syphilis rate is so high. And this is the thing that we have to think about with contained populations. Where is it coming from? When we think about that, we think about, wait a minute, a lot of people are discounting jails because they're closed environments, they're single sex closed environments. And it's okay, well, things are spreading. And we have to be very stigma-free, open, and honest about those things. We have found the sheriffs as partners to be very open and honest about those things as well. And so that is kind of a, if not us who, situation. And we know correctional health is stretched thin. We also know that public health has a different way of doing sexual health, reproductive health services. And so that just is a good fit
for those sorts of things. So, the jail project is really a pilot at this point. And so it's really thinking through how can we expand potentially our presence, our public health presence in those spaces. But that's another reason we need to dig deeper into some of these, it's not that many, like if you think about it, syphilis is still, again, just like I was talking about congenital syphilis, rare, but shouldn't be around anymore. We thought we got rid of it, right? And so it is one of those things where, look, we can dig deeper. We can figure this out. We can talk to people. It isn't that huge of a burden. It's not like we're trying to interview everyone who has a common cold, right? That we can start to connect the dots. And Christine, who's going to be up later, we were just talking today about, do we need to get an IRB? Like, do we need to do research? Like, so we're thinking through that as well as exploring those academic partnerships to kind of get more of that big data. So long answer to your very short question, but I hope that helps illuminate a little bit. It almost feels like you're looking in the dark, like, and you're just like, let's just go for these populations right now. Like, and then we can do something else later, but for right now, we have to go all in on a couple different sub-segments of the population and make sure that the Hispanic residents of Jefferson County, we are super intentional and thoughtful about the way we do anything. And that's why I thought we can't just make this up as we go along. Like, we need someone who is full-time committed to this. So that hopefully will help us with that priority population there. Thanks. Anything else before I talk a little bit about Katie and then move to our different teams? Okay. This month on the honor roll, which, as you'll recall, we changed our recognition program. And so now we get to lift up more people, which is exciting. We got more nominations for Katie than we've ever got for a single person. So it was very exciting. Her team really rallied. They must have organized around her. The funny thing about Katie is she's not even technically an employee of JCPH. So Katie is an AmeriCorps fellow, which means that, she's not eligible for some of the compensation package of the honor roll, but we are throwing her a pizza party tomorrow. So there is that. At least the whole clinic is going to get pizza tomorrow. But I want to tell you a little bit about some of the things Katie's nominators told us about her. I loved this, that she comes to work every day with a smile on her face and the most chipper attitude, which on some people is quite irritating. But when you meet Katie, it's completely genuine and beautiful. I loved this one. Everything she does is high quality and evident of attention. And I thought that was like such a testament to her commitment to excellence. She is doing meningitis work. She's helping to stand up nicotine replacement therapy for youth. She's the one who says, I'll get the coffee and the bagels and the pastries donated. I mean, that's not part of the job description for an AmeriCorps fellow, but she's out there just hustling to do it because she cares so much about this work. And she's especially really focused on those who are experiencing homelessness, and that she treats every single person with respect, dignity, and compassion, and that she even actively engages with the people that she talks to in the community to get their ideas about how to improve the process of what they're doing. So she has great trust in the community, and they trust her too. So join me in applauding Katie. I don't even know if Katie's on this call because she's probably busy doing clinic stuff. But I hope you get to meet Katie eventually. And she's just such an asset to the team down there. She brings a great energy. So thank you, Katie. I even made her a special slide. There she is, somewhere cool, it looks like, in that picture. Okay, this is the order we're gonna go. I like to have Kelly go first, only because we have policy updates and you just heard a bunch of stuff about syphilis. And then we'll have Christine talking about a bunch of quick updates. Max has a very important update on our chief medical officer team, which you got an email about, but we can talk about publicly. We have our employee of the month announcement, and then Jim is gonna bring us home talking a little bit about West Nile. So it's a nice buffet of things we have coming at you. So Kelly, the floor is all yours.
I'll probably circle back to syphilis in a second, but
Okay.
just to follow up on a lot of what we talked about last time, which was what is going on with the state budget. I think around the time of our last meeting, the revenue forecast had just come in. Since then, the Joint Budget Committee has pulled together a long bill that has made the rounds, is now circled back to the JBC, which will establish the fiscal year budget for next fiscal year for the state. The most recent numbers I've heard is that money available to legislature for new policies is about 25 million, which isn't a whole lot. Unfortunately, they have a lot of big things that they are trying to do. And unfortunately, 25 million just doesn't push all of those things through. So this year, for the first time, they're doing a public prioritization process of bills that they want to prioritize for that limited amount of funding. Led to, I think, some interesting times over in the Capitol as they're working through that process. So we've started to see, since the budget picture has become clear and they know how much money they have to work with, bills that were introduced much earlier in session and have been parked in appropriations committees are beginning to move, and some bills that don't have a fiscal impact have been and are continuing to move through the process since they don't have that limitation of needing funding to be implemented. So lots of things happening. Been quite interesting. We've also been tracking some individual bills along the way as well. There was a bill we had some concerns about related to public information on chemical spills and releases, wanting to honor that there needs to be information in plain language available for folks who are concerned about potential exposures to chemicals. However, the strategy in the original form of the bill was to use emergency notifications for situations that may not cause an imminent harm to folks when a chemical is spilled or released. The risk of chemical spills has a lot to do with dose, proximity, how the chemical works, and the original criteria in that bill didn't always equate to a safety concern. So we want to make sure folks are listening to and paying attention to those emergency alerts when they come out for things like wildfire evacuations, amber alerts, that type of emergency. So the bill sponsors were great about meeting with us and some other public health agencies, hearing from emergency managers to find a way to make sure that that information is available to community members in plain language when they want access to it, but not doing that through an emergency notification and causing that notification fatigue. We've also been following some legislation that passed last year that is moving now around continuous eligibility for Medicaid. So a bill last year that passed directed HCPF to seek a waiver to allow for continuous eligibility for Medicaid for kiddos who are age 0 to 3 and for adults who are incarcerated to give them 12 months of continuous coverage so that those two groups don't experience disruptions to their healthcare coverage at times when they really, really need it. So that waiver has now been submitted to the federal level, and the state will need to wait to hear back on that. But some interesting and some good progress there to make sure that folks have the coverage that they need. And then circling back to syphilis, which seems to be the theme for our meeting today, there's quite a bit of policy work going on in that world. Rochelle, to your point about the health alert that went out, with those guidance updates, going to universal screenings for folks who are sexually active instead of a risk-based screening, which takes a little bit of the work out of providers just to screen everyone versus to assess someone's risk during a visit, increasing the recommendations for not just one syphilis check during prenatal care, but that third trimester and delivery check as well. And then yesterday, a bill was introduced that we've been collaborating with Adams County on that would require not just that first prenatal test for syphilis that's already in statute, but add that third trimester and that delivery check in statute as well, since we're seeing rates only continue to rise. And as we test more, we know we will find more, so the rates are not likely to come back down for some period of time. So looking to have that change made so that providers are seeing that that's required and implementing those testing requirements, both so we catch folks throughout their prenatal care journey, and then for folks who don't receive prenatal care, they would have the opportunity to be screened when they present for delivery as well. There's a lot that's needed to address rising syphilis rates. Like your story talked a lot about the different things that we're working on. There's additional resources that locals really could benefit from in the form of funding as well as staff capacity. We have a great opportunity with the jail work, which came out of a budget request CDPHE made on our behalf last year to expand the program that they've been working on in Pueblo to us, as well as to El Paso County. Unsurprisingly, based on the results Pueblo had already seen, we've been finding quite a bit of syphilis in the jail, and that partnership is really something we could build into to address syphilis testing and treatment in our male population as well. And we will need resources to be able to do that. And to Dr. Story's points too about data and understanding where is syphilis coming up in our communities across the county, what's contributing to it going undetected. That data really is something that we need a better picture of at the local level so that we can tailor what we're working on to what's happening in the community. And I think there's a number of ideas that we have and ways that we can go about trying to make sure that we've got that clear picture as well as we bring new resources in to address the issue. With that, I'm happy to take any questions if y'all have them for me.
Any questions for Kelly? Sarah?
Yeah, you mentioned the budget. Is there any update on the local public health funding and whether it was changed or adjusted in the long bill?
It was close to the original ask, so it was adjusted slightly. The original ask and what they originally awarded before that revenue forecast came in was the $12 million ask. I believe last I heard the final ask that made it into the long bill was 11 million for local public health funding.
Thank you.
And thank you for your testimony. I sat through that incredibly long committee hearing where you testified on the community right to know bill.
It's a long day and good to learn more about the issue too. I certainly heard some ideas from the other folks that testified about how we can make sure that information's out to folks that need and want it.
Yeah, no, an important issue, just not the right fix.
Yep.
All right, Christine, I think
you.
you're next.
Am next with really bad fingers. My apologies. Good afternoon, evening. Just a few updates from me. Hopefully you all saw that last week, a week ago exactly, we released both our annual report and our county health improvement plan. They were released officially to the community on that date, although I know several of you have had various opportunities to interact with both of the documents, but they are officially released to our community for use. We hope that both you, the board, and our community members are able to reach out into those documents and see what 2023 held for JCPH as a department in terms of our numbers, and then what the county health improvement plan creating a healthier environment moving into the future. So if you haven't had a chance to look at them, please make sure to do that. Huge shout out to our health planning team and our data science and epi team and our community for participating in the development of those documents. We have an update on some infectious disease work that is emerging. We are tracking a outbreak of highly pathogenic avian influenza. You may recall there was an outbreak among, in particular, bird farms last year and the year prior. This one in particular is in dairy milking cattle, which is pretty unique. So the infectious disease epi team is tracking that. To give you a couple of numbers around that, as of noon yesterday, it was reported that there have been 28 confirmed cases in livestock across 8 states. Of important note, none of those are in Colorado. So there are no confirmed or suspected cases of this highly pathogenic avian influenza within the state of Colorado, but we are tracking it very closely and are receiving updates through our infectious disease epi team. We learned from COVID that we want to be ahead of emerging infections, so they are doing a great job with the surveillance on that. Switching gears a little bit into wind, blowing into the meeting here, I guess. I'm sure we all are well aware that the weekend of April 5th through the 7th, so last weekend or the weekend prior, we had a pretty significant wind event hit the Front Range, and in particular Jefferson and Gilpin counties. And Boulder counties received a lot of impact from that wind event. One of the things that happened during that was that there was de-energizing of the power lines. And that caused a lot of significant impacts for the communities that were affected by that. They were short notice, they were longer term than were communicated. So there were a lot of lessons learned by members of the community in terms of their need to be prepared, as well as a lot of lessons learned from agencies that provide those services. Our team, with the support of both the health communications staff and our environmental health services staff, responded over the weekend. We were activated in support of the County Emergency Operations Center. So if you are familiar with how that is laid out, we sat in the Emergency Support Function 8 role in support of the broader county response. There was a lot of coordination of information, a lot of outreach between healthcare facilities and public health to make sure that those facilities were not impacted by the fire. That's what I'm used to, the wind. And if they were, to make sure that they were ready and prepared. There was a lot of work done by our EMS agencies around those who were dependent on power for oxygen. We had an oxygen work group regionally. The impacts of that were felt during this event, and now there's more work to do. Huge kudos to the Jefferson County team, the city of Arvada. There was a particular outreach from the American Lung Association, thanking the county and the municipalities for their response. And Anjanette Hawkins, our EPR coordinator, was right on top of that thanks and pulled them immediately into the work group related to oxygen. So that will be great outcomes from this wind event that occurred in the county. And then last, but certainly not least, that same team has been working hard across the county to support education and operationalization of points of dispensing and getting prepared for if and when we have a bioterrorism event. So on May 9th, we would like to cordially invite our Board of Health and all of our staff that are on this call to attend a test of that process to dispense those medications in the event that we were to have that bioterrorism attack. This is one part of a very large response, as you can imagine, but it's a very important part because it's getting those protective medications into the hands of those that need to have it, which in this case is everybody. So you will be receiving an invite directly from Lindsay. She will be sharing that with all of you. And we truly hope that you can attend on May 9th. It's in the middle of the day, and yours truly, along with Dr. Story, will be leading all of our amazing VIPs through the event to give you a chance to ask questions and then have you go through the process as well. So that is all I have.
Thanks, Christine.
Yeah.
Max?
Thank you.
Hello, everyone. I'm going to kind of piggyback off of Christine a little bit, not public health related for a second. I have some very good friends that are linemen working in Lakewood. Those guys are doing amazing work. Ever since the windstorm, they've been on 716s, the entire crew nonstop. So if you see any linemen out there, buy them a sandwich, bring them some donuts or something. They are starving and they're tired, and they're doing a lot of good work. So definitely support them however you can. As far as CMO update, very excited to say that the contract has started its execution on the 1st of the month. So we're a couple weeks in. I did see Dr. Foldy on the call, I believe, and I saw an Amy in there earlier, and I don't know if that was Dr. Beeson or not, but we do have Dr. Belknap, Dr. Schley, Dr. Foldy, and Dr. Beeson who will be operating as our CMO team. I'll try and slow down as well. I forgot about transcript. They are a phenomenally talented and diverse and knowledgeable group. So I'm looking forward to work on top of what they've already been doing for us. Didn't set them up to present or introduce themselves today, hoping to do that next week, just because we're only about 2 weeks in. It's mostly been getting them established through IT, getting everything set up, getting them a little bit of context, and also having them comb through dozens of standing orders that we needed to turn over from Dr. Johnson as well, just to keep things operating. So hoping to hear from them next week. We have a meeting with them this Thursday, the entire team in person, to just talk about our continuity of operations and how we plan to move forward and what's going to work best for everyone. So do expect to hear from them as a team soon. They are already giving us plenty of great feedback on standing documents. So again, really, really excited to have them here, have their input and all of their support and their expertise. So thank you to any of them that are on the call right now. And as far as outreach coordination, we're kind of surveying as an organization, how are we best operating in the community? How are we breaking down these walls and maintaining agility as well as transparency to one another when we are out in the community with partners? We have had in the past situations where 2 JCPH programs have shown up to an event not knowing they were going to be there, could have joined up forces, supported one another, and put a shared effort into things. We also have multiple partnership opportunities through singular partners where we don't know that we're attacking them from multiple sides. So what we decided to do to restructure that and become more of a cohesive singular unit as JCPH, as we do break down these walls, is we put together an outreach coordination group where we have been working on defining what we see as being true outreach in the community. How are we measuring the effectiveness of our outreach? How are we utilizing data to understand where we need to be in the county with what services and maybe gaps that we don't even see until we start providing some of the existing services in those regions. And it'll also help us paint a very clear picture of maybe the gaps that we can't fill, and so that we can figure out how to best engage with our partners, utilize them effectively, and also be a resource and tool for them to utilize for maybe programs we have that they're just not able to build out or find anywhere else. So working on that right now, especially with the launch of our van, our clinic van going out and being able to expand services, working with Community Health Partners group and EPC, and very much in the earliest stages of that, but just kind of wanted to put it on everybody's radar. So if there's anybody that you think of that would be great, or a great opportunity, great idea that you might have around that mission, please feel free to reach out to myself or Christine or Alex. We're all on that group. But it's an exciting step into this next chapter of what JCPH is going to be able to do in the community how we're going to be able to expand and come full force to these areas in a very meaningful and measured way. Those are really my only two updates, but I'm happy to answer any questions that anyone might have around them.
Thanks, Max.
Yeah, absolutely.
Right. I think Family Connects is up then.
Hello and good evening. Can everybody hear me? Yes.
Yes.
Hi. My name is Kate Follett. I am one of the nurse supervisors in the Community Health Partnerships Division. And I have the pleasure of introducing our Employee of the Month. Although, if I can be honest, I think the real honor for me is getting to support this person in their work. So, Rosie Ramirez is our Employee of the Month. Rosie fulfills a hybrid role for the Family Connects program. She primarily fulfills the role of program support specialist, but she also fulfills a lot of the responsibilities of community alignment as well. So we nominated Rosie as a team. I am going to read the team nomination, and then I'm going to pass to one of the Family Connects nurses who is going to share something with Rosie in Spanish. How do we begin to count the ways that Rosie demonstrates the guiding principles of JCPH? With her bilingual skills, she effectively communicates with families and nurses as she coordinates the schedule for Family Connects home visits. After the visits, she follows up with post-visit calls, ensuring excellent customer service and connections to local resources for families. She ensures equity among the nurses as she balances patient loads and varying schedules. She collaborates and advocates for staff when complex tech systems falter. And once again, she stands in the gap to patiently provide support. She faithfully keeps our program running, both from behind the scenes and public facing as well. Did you know that she was so brave and amazing as she aced the Telemundo interview for Family Connects? She proves herself trustworthy and full of integrity every single week. Because of her expertise, Rosie is profoundly innovative as she directly assists families who need extra time and support, even promotes our program in her free time, and seamlessly manages her complex hybrid role. She is also an amazing mama to boot, an inspiration to us all. Thank you, Rosie, for all that you are doing for our Family Connects team, for JCPH, and for the families that we are serving. And now I will pass to Amy Sue.
Hi, everyone. Can you see me and hear me okay? I hope. So I'm Amy Sue Pinto. I'm a nurse with Family Connects, and it is also my honor to work with Rosie Ramirez. And since she's fully bilingual, I thought I would do my part in Spanish. Also because I feel like thoughts and emotions that are expressed in Spanish come out just a little more poetically and meaningfully than they do sometimes in English. So here goes in Spanish. Soy Amy Sue, una enfermera con el programa Family Connects. Tengo el privilegio de trabajar con Rosie Ramírez como mi compañera de trabajo. Ella hace su trabajo aquí para el condado de Jefferson con profesionalidad, competencia y aún más de eso, muchísimo amor. Rosie es inteligente, paciente y una experta en comunicación con las familias y también con nuestro equipo. Es una bendición conocerla y aprender de ella. Rosie, en frente de todos, quisiera decirte que tú mereces este honor. Estoy súper agradecida por ti y todo lo que haces, no solamente por nosotras en el grupo, pero también por todos a tu alrededor. Desde el fondo de mi corazón, gracias, Rosie. Muchas gracias. And then I'll pass it back to it looks like to Jim Rada / Dr. Story.
Thank you. Congratulations.
Kate and Amy Sue, that is a hard act to follow. And certainly not, West Nile virus isn't the most exciting thing when it comes to following such an excellent presentation. Congratulations, Rosie. I believe, Lindsay, you were going to have the slideshow up.
Sure, just give me 1 second.
Thank you. Because you all don't want to read my notes, so, and I probably don't want you to. But good afternoon, board members. As we move toward the warmer summer months, I've been asked to provide a brief overview for you today of West Nile virus data from 2023. And I want to first of all give thanks to the EPI team and some of our EHS staff and to CDPHE for the data that I'll be sharing with you this afternoon. As you may know, 2023 was a really active year for West Nile virus in Colorado and also in Jefferson County. It was really an active year for those pesky critters, those vectors, mosquitoes that we have here locally. Heavy rains in May and June, followed by very, very hot weather in July and August, created ideal conditions for breeding of mosquitoes in much of the state. And although West Nile virus disease has been endemic in Colorado for a couple of decades now, 2023 numbers of cases jumped significantly over earlier years. Next slide, Lindsay. Whoa, I can't read that fast. And my computer is now broken. Okay, this slide shows the case counts of West Nile virus from around the state. In total, there were 631 cases of West Nile virus reported in Colorado. Of those cases, 310 cases were reported as neuroinvasive disease. I'll expand on that a little bit in a few minutes. 383 cases resulted in hospitalizations, and there were actually, sadly, 50 deaths in Colorado related to West Nile virus. It should be no surprise that the largest case counts were mostly in the heavily populated parts of the state, including Jefferson County. However, the distribution of cases around the state were fairly consistent with most years. Next slide, please. Case counts accelerated a few weeks earlier in 2023 with peak counts occurring around mid-August, slowly diminishing over the following 8 to 10 weeks until the fall set in. Note that on this graph, the 2023 weekly case counts were far higher, that's the orange line, than the average weekly counts from the previous 5 years. So you can see how dramatic the difference in case counts were to last year. Next slide, please. Here's the case counts of West Nile virus by year in Jefferson County, 2023 far overshadowing any of the previous 5 years. Jefferson County's 64 cases ranked second only to Denver's 97 cases reported. Next slide, please. On this map, we can see the distribution of West Nile virus cases in Jefferson County by address of residence at the time of the diagnosis. As you can tell, if you can kind of, the yellow highway lines there kind of outline the urban center or urban core of Jefferson County. And cases appear to be fairly ubiquitous across the more heavily populated areas in Jefferson County. We're not able to determine if people were infected at their place of residence or maybe while they were away from home, because our epidemiologists do not collect that information about activities where people may have been exposed to mosquitoes. Regions of Jefferson County not shown on this map did not have a density value high enough to be displayed on the map. So the darker spots that you see on the map indicate the greater density of cases in those areas. Next slide. This chart shows the primary syndrome diagnosis of cases of West Nile virus for each year between 2018 and 2023. We see an increase in the amount of neuroinvasive disease, roughly 40 cases depicted by the orange, green, and yellow bars in 2023 compared to the uncomplicated West Nile virus in the last few years. That's the blue bars. Neuroinvasive disease includes acute flaccid paralysis, meningitis, and encephalitis, whereas uncomplicated West Nile virus only includes fever. Next slide. We do not appear to be transmitting more cases of West Nile virus through blood donations, thankfully, as the data does not show that a lot more cases are being detected through donated blood, as indicated by the blue bars on this graph. West Nile virus is being identified mostly in the clinical setting. Next slide. So in environmental health, we do our part to kind of oversee or monitor where mosquitoes are developing. And so mosquito trapping is conducted in many areas across the state to identify where vector mosquitoes, primarily the Culex species, may be most prevalent. This data from the CDPHE West Nile virus website shows the number of mosquito pools submitted for testing last year. Note that the large numbers of mosquito pools tested in Larimer and Boulder counties far exceed what we see in most other parts of the state. I think this is likely related to a large amount of research being conducted by the Rockies and High Plains Vector-Borne Disease Center at CSU. And in 2023, the Jefferson County Public Health Mosquito Surveillance Program submitted 4 pools of Culex mosquitoes from our 3 trapping sites over our 12-night trapping program throughout the summer. And that is shown in the table on the lower right-hand corner, where we see that 4 pools were submitted, 3 were negative, and we had 1 positive pool. And you don't see any dots on our map there on Jefferson County. It's because our numbers are so low, we submit combined pools from all of our traps instead of individual mosquitoes or smaller pools from individual traps. So usually if we collect Culex species with And the last data I wanted to share with you is the mosquito data collected from Jefferson County traps in 2023. Not huge numbers like we might see in some areas, especially irrigated farming areas and wetland areas, but note that roughly 12.5% of the mosquitoes caught in our traps were the primary vectors of West Nile virus, that being the Culex T at the bottom of the table. Thankfully, that number was not higher, as this could have resulted in much higher case counts across Jefferson County. It appears that if wet, warm conditions develop again this summer, there could be a significant reservoir of virus in the environment, which could lead to large incidents of West Nile virus again in 2024. We are working hard to identify resources to help us continue with mosquito surveillance work as we enter the warmer summer seasons in 2024. We've connected with the Rockies and High Plains Vector-Borne Disease Center at CSU, as just last week we learned that they have received additional funding to expand their research area across the mountains and the High Plains states. We hope that perhaps they might consider us as a partner in their project. I know they've done a lot of work in Larimer, Boulder, and northern Boulder County, so I'm hoping that they might consider expanding southward into Jefferson County. We're also working hard to identify resources to help us continue with mosquito surveillance work as we enter the warmer seasons. We're connected with the I did mention the Rockies and High Plains Center. We're also continuing to work with the National Environmental Health Association's National Environmental Public Health Internship Program, from which we had a intern last summer, and other resources in the community to see if we can find adequate staffing to carry out the program for the summer. And I hope to be able to bring you an update on our search at next month's board meeting. So with that, I'll answer any questions.
Thanks, Jim. Sarah, go ahead.
You alluded to this, but I'm just gonna check an assumption, but this cause, or the assumptive cause of this spike in 2023, is due to the wetter than usual spring and warm weather, correct?
I would attribute it to really wet, cool spring, which allowed water to stand around much longer. And then we had that tremendous spike in temperatures in July and August, which really are ideal breeding conditions for mosquito.
Great. And I think it's just important to make sure we're clear on that, because I think it's an important point in the with the chip and the climate change as a priority for Jeffco. This is a clear indication of that demonstrates why that was an important priority for the county.
Absolutely.
All right, I think if there's any other staff that would like to have had comments, can entertain those now. If not, we can move to board comments.
I can never find my hand.
Oh, go for it.
Okay, I found it. You know what? Nothing in particular, but again, we have got the most remarkable staff. The work that you all are doing is just so phenomenal. And the fact that people are now looking to Jefferson County for, the best model and the best practices and stuff is just very, very exciting. So thank all of you for the hard work that you're doing and putting us on the map as the experts.
Sherry.
I have just one small comment in that, one, I echo what you said, Sherry, and I do hope that we are looking at that excellent AmeriCorps member, and as their term of service ends, that we work to keep them in public health and perhaps at Jefferson County to see and understand how we build them into our next public health leaders.
Ditto, ditto. Good point, Sarah.
Yeah, it is exciting to see the new folks coming into the field. So good job taking advantage of that program. Well, I want to just send another congratulations to all those public health champions, and really encourage staff to see that amazing work that the team put together, the videos that they created. It was an excellent ceremony. I think the honorees really felt very, very warmly congratulated. They were very excited to have the boards that they got to take home, in addition to the nice little plaques, trophies that you gave them. But it was a wonderful ceremony. So, and it is always inspiring to see the work of the teams and the partnerships that they've created in the community to continue to do that work. And I hope the community members can see that too, because again, there's so much amazing stuff happening that most folks aren't unaware of. So.
And my deepest apologies for not being there. This is the first event I've had to miss. I was so bummed, but sometimes things conflict and you can't get out of them.
It is hard. And I know you were there in spirit. And
yes.
But it was also great to see that we had all of our commissioners there, and that just is another testament to having support from our elected officials for this
Yeah.
amazing work. So
And Sherry, I second that. I missed this year as well, and last year was delightful. So I'm sad I missed, but it sounds like everything went very well, and I'm excited for all of our winners.
So,
Harriet.
and I'm like Sherry, and I can't find the little hand, or when I do, I miss my chance to talk. I also am sorry that I missed the event, and I also want to apologize in advance that I'm going to miss so many events in the next coming month. But I'm going to be out of the country for a month with important things like a grandchild wedding and a great grandchild, very young, just born, that I get to see. So I do apologize, but you know, I'll be back after the next meeting, but I will miss the next Board of Health meeting. So sorry.
Well, enjoy your family, Harriet.
I will.
Well, and if there's no further business, again, thank you all for your time and efforts. We will conclude this board meeting. Have a good evening.